Hello, I'm Nurse Lane.
And I am Nurse Jenny.
We're going to be teaching you today about what we want you to do at home when you're discharged from the hospital. This will take about 5 to 10 minutes, and we'll be teaching you information to use at home that will help prevent you from having any future hospitalizations. We have to make sure that your mom is here with us while we're teaching you because she's going to be the parent at home that's helping you manage your asthma the most. You were admitted to the hospital with a diagnosis of pneumonia, which means that you had an infection in your lungs. But we cleared that all up now, and we want to just teach you about ways that can prevent asthma attacks at home. So we have some supplies here that we're going to be showing you how to use today, and a lot of them will probably look familiar. So the first one that we have is a rescue inhaler and a spacer.
So I'm hoping these look a little bit familiar to you. Basically, they have instructions on the back, and you're going to start here and kind of work your way over, and you're going to follow the little bear. The first step is to shake your inhaler up, and this is for rescuing. So if she has signs of an asthma attack, this is what you're going to want to use first. So you shake up your inhaler, and you're going to attach it to the orange part here, pop it in there. And you want to make sure her nose and her mouth are lined up here, so like that, and make sure there's a nice tight seal so she gets all of the air from the inhaler. So you're going to do a nice puff, and all of that inhaler is going to go in this tube, and you want to make sure that she takes at least 6 breaths of this, of the inhaler.
The next item that we have is called a nebulizer. So your doctor wants you to go home with this as well because it'll just continue to help your lungs.
So we have a couple parts here. We have the mask, the tubing with the medication holder, and then the medication itself. So what you're going to want to do is open up the medication holder, the chamber here, and pour and squeeze all the medication in there. And you're going to put the cap back on. And then you're going to connect these two pieces together, the mask and the tubing, and then the end of this tubing here goes into the nebulizer machine, and then that's what you'll turn on. So just like with the spacer, you're going to put that on your nose and the mouth, and you want to make sure she takes nice deep breaths when you turn it on, and it's going to be like a whole bunch of air that's just going to be pushing into your body. And you might have to kind of shake this until all of the medication is gone. What's really important with this too is you're going to want to make sure to clean it after every use. So you'll just kind of take all of these pieces apart and rinse them through with water to make sure all of the medication is rinsed out and everything like that too.
And then the last item that we have, you probably used a lot while you're in the hospital. We call it an acapella, but we can also call it a pickle.
And just like you're blowing bubbles in your soda, you're just going to put your mouth on this piece here and blow as hard as you can, and all of that's going to vibration in your chest. It's going to break up all the bad stuff in your chest.
So there's a couple more instructions that we would like you to follow when you go home, and those are to drink a lot of fluid, and it can be water, milk, or juice, whatever you would like to drink. Also, staying active is really going to help prevent any future hospitalizations for pneumonia, but also making sure that you are taking frequent rest breaks when you're playing in the yard or anything like that, so you don't trigger an asthma attack. Making sure that you're eating healthy, and even if you're not hungry, ask your mom for a Pediasure, and it's like chocolate milk, so that'll help make sure that you're staying within your caloric intake. Making sure that you're carrying a rescue inhaler at all times, or making sure that your mom or any other family member that's watching you has your rescue inhaler. And then for mom, making sure that you're teaching any caregivers or family members about your daughter's asthma and about how to use a rescue inhaler and who to call afterwards. And then developing an asthma action plan to use around the house or to give any caregivers or family members is also very important for the care of Sabina with her asthma. And then avoiding allergens that may trigger an attack like pet dander or pollen or any dust like that is important too.
We're also going to be sending you home with this little brochure pamphlet type of thing. It just kind of goes through everything we're talking about as well, and has fun pictures and everything. But it'll talk about like your physical activity, the nebulizer, the inhaler, signs of an asthma attack, what to do, how to prevent it, everything like that.
So there's a couple things that you're going to have to watch out for, and if any of these occur, you're going to need to call Sabina's doctor. So if a rescue inhaler is used more than 2 to 3 times a week, that's an urgent situation and the doctor needs to be called. If she's having a very bad asthma attack, and the following symptoms that you would see would be things like confusion, Sabina being unable to talk, reports of chest tightness, if you're seeing any blue skin, wheezing, nostril flaring, and then rapid breathing. If she uses a rescue inhaler and then 15 minutes after there's still no change in her breathing, then you would have to call the doctor as well. And then if Sabina is still not feeling good 2 to 3 days following the use of a rescue inhaler, it's also very important that you call the doctor then too. So we've just got a couple questions for you that we'll ask you when we come in and talk to you. And those are, if you know the concerning signs for an asthma attack and what you need to do for them, how to use a nebulizer at home, and then when you need to use a rescue inhaler. And if you can answer all of these questions without any difficulty, then you're ready to go home. But if not, please review the video again, or you can ask us questions when we come in, or you can ask your healthcare provider as well.
Thank you and have a good day.
Thank you.